Hello everyone. Today I am going to discuss about the complete guide to treadmill test, which is generally known as TMT. Understanding how your heart performs under stress is critical for diagnosing and preventing cardiovascular disease. So this treadmill test, it helps in the diagnosis of activity of the heart during physical exertion. Physical exertion means when the heart works more than the sedentary condition. Sedentary condition means when the person is not working at all, sitting idle, listening to something, like there is no exotic physical activities. So, what is treadmill test? Treadmill test or TMT, also known as exercise stress test, means when a body is under exercise, like happens in the treadmill when a person is running on a treadmill or working on the treadmill, it's an exercise and it provides some stress on the body. And it's a non-invasive diagnostic procedure, means no needle or nothing inserted inside the body. The test is done outside the body. That evaluates how your heart functions during physical activity. So it is aimed to uh, see the activities of the heart. Since the heart pumps harder and faster during exercise, the test can reveal problems that might not be appeared at rest. Maybe, for example, the heart of a patient is weak, but as because he or she is doing its regular activities, so it is not possible to identify by anybody or by himself or herself that the condition of the heart is not good. But when that particular person is diagnosed or forced to run on a treadmill, then he or she might not cope up with the stress of the exercise, and then the doctors or the cardiologist can identify the hidden problem of his or her cardiovascular system. So during this test, a patient walks or runs on a treadmill while sophisticated instruments monitor three things. Now, what are the three things? Number one is electrocardiogram. That means how the ECG changes, electrocardiogram patterns, how the ECG changes when the body moves. Next, blood pressure fluctuations, how the blood pressure changes when the whole body is doing exercise. Next, heart rate response to increasing workload. As the workload increased, then what is the changes in the heart rate? So three uh, particular parameter has been checked. Number one is ECG pattern, number two is blood pressure fluctuations, and number three is heart rate response with the increasing workload. Now we have to know what is the basic purpose of TMT, means why the doctors will prescribe the TMT and why a patient will go for a TMT. Number one, to detect the coronary artery disease, means if there is any problem in the coronary artery. We all know about coronary artery. It is the artery which is situated within the cardiovascular system in the heart. It helps to identify the blockage in coronary artery. That means if there is any blockage in the coronary artery, that will be identified by the TMC. Means how it will identify? Revealing ischemia. That means the blood flow will be reduced to the heart muscle. So the heart may not work for a long period of time and it will surrender. So it is helps to detect the coronary artery disease. Next, it uncovered arrhythmias. Arrhythmia is just opposite to the rhythmic. Means our heart has a normal rhythm, but if there is a problem in the cardiac muscle or the activities of the heart, then there will be arrhythmias or some abnormal heart rhythms. So TMT can trigger and document this otherwise hidden arrhythmia that may cause symptoms. Next, Assess the exercise capacity. That means whether a person is capable of doing a certain amount of exercise by measuring the functional capacity in metabolic equivalents like METs. TMT provides objective data about cardiovascular fitness and prognosis, means if there is any progressive problem within the heart. So three main things we have to uh, keep in mind, that what are the three basic purposes. One is to detect the coronary artery disease. Number two, to uncover the arrhythmia. Number three, to assess the exercise capacity of the person. What are the major indications for TMT? Why a person will go for TMT? Number one, for chest pain evaluation. If a person feels some chest pain or discomfort in the chest but don't know what is the basic reason, then this person may go for the TMT, where the underlying reason will come out. Next, post heart attack assessment. After myocardial infarction, TMT helps establish prognosis, determine exercise capacity, and guide the rehabilitation program. That after myocardial infarction, how the heart works. Pre-exercise clearance. This is mainly done in case of the older adults and those with multiple cardiovascular risk factor, that whether a person is fit for any particular exercise, that is clearly determined by the TMT. So there are three basic indications. So number one is chest pain evaluation, number two is post heart attack assessment, and number three is pre-exercise clearance. What are the benefits of TMT? Why a person will do TMT? Number one, real world simulation, means TMT replicates actual physical exertion, providing a more authentic assessment of how the heart performs during daily activities. So if a person or if that particular patient can overcome the stress of the TMT, that means in a regular daily world, he or she is fit to do any type of job. Cost-effective screening, that it is much more less cost than other stress tests. Widespread availability, it is available, this type of available in even in the primary healthcare center also. So these are the benefits why a person will go for TMT. Now, how the test work? Actually, there is an initial assessment. And what is that? The procedure begins with baseline measurement of vital signs. You know what the vital signs are. That the blood pressure, then heart rate, respiratory rate, etc. Then comes the exercise phase. There are several standard protocol like Bruce protocol, modified Bruce protocol, and Norton protocol. So any one of the protocol can be chosen. And regarding the treadmill speed and the inclination, which is increased every 3 minutes. So after every 3 minutes, the inclination of the treadmill, which will give the feelings of walking on a mountain or hiking on the mountain, and the speed will also increase, and it will give an extra stress on the cardiovascular system. Next, the recovery phase. After reaching the maximum exhaustion, monitoring continually for 6 to 8 minutes during the recovery, when more significant changes may actually become more apparent. The entire procedure typically takes 48 minutes and the actual exercise portion 7 to 12 minutes for most patients. So this is how it works. There are three basic steps. Initial assessment, where the vital signs will be checked. Exercise phase, where gradually the exercise duration and the speed and the inclination will be increased. And the recovery phase, where the heart rate are allowed to come back to the normal value. And the total is of 45 minutes and the exercise portion 7 to 12 minutes. Now coming for the step-by-step procedure, number one is pre-test preparation. How a patient will be prepared for the test, pre-test preparation. Medical history have to be noted down. Baseline vital signs will be recorded, and 12 lead ECG electrodes should be placed on the chest. So these are the three pre-test preparation. Next coming is the exercise protocol. Patient begin walking at a slow pace, 1.7 mile per hour, with gradual increase in speed and incline every 3 minutes according to the protocol. So this is the exercise protocol. Now monitoring. Continuous ECG recording, blood pressure measurement and which at each stage and symptom assessment throughout. And conclusion. Test ends when target heart rate achieved 85% of the age predicted maximum, or limiting symptoms like recovery monitoring follows. So these are the step-by-step procedure, which are like pre-test preparation, number 1, number 2, exercise protocol, number 3, monitoring what is happening during exercise, and number 4, monitoring the recovery. Now, monitoring during TMT, what we will monitor when the TMT will go on. Number 1, ECG changes. Very important. Technicians observe the ST segment depression. This one is very important. So ST segment depression less than is equal to 1 mm, indicative of myocardial ischemia. So if during TMT it has been found that the ST depression is greater than is equal to 1 mm, then it indicates that the person may be suffering from myocardial ischemia. There will be T wave inversion and any rhythm disturbance that emerge during exercise. So these are the ECG changes which a person have to monitor, cardiologist have to monitor during TMT. Now what are the hemodynamic response a person have to work, a cardiologist have to monitor? Blood pressure should rise increasingly with exercise, approximately 10 millimeter of mercury per metabolic increase. A drop in systolic pressure greater than is equal to 10 millimeter of mercury during exertion is abnormal and concerning. So this is the checkpoint. Hemodynamic response, the blood pressure should increase as occurs during as because the circulatory system is exhausted. That means the flow of the blood will be increased. That means that will give extra pressure on the internal wall of the blood vessels, which will gradually increase the blood pressure. And this is normal. But if there is a drop in the systolic pressure that is greater than is equal to 10 millimeter of mercury, then that should be monitored. Symptomatic assessment. Patients are regularly asked about the chest discomfort. Means they will categorize the problem in the chest if they feel any anginal pain, if there is any discomfort in the chest, if there is numbness in the limbs, if there is dizziness they are feeling, if any nausea, vomiting like of a problem, then shortness of breath, if they cannot respire properly, if there is dizziness and fatigue. These are subjective measures are correlated with objective findings. So 3 things to be monitored in a very minute way during the TMT exercise. Number 1 is changes in the ECG, and there is ST segment and T wave. These 2 are the main thing to be monitored. Then hemodynamic response, then symptomatic assessment. So regarding the patient preparation before the test day, the patient should consult with the doctor about the medications. Should they continue the medication or they stop for the TMT test? Caffeine should be avoided, tobacco should be avoided 3 hours before the test, because these 2 are the stimulating agent for the cardiovascular system. Get adequate sleep in the night before. Without adequate sleep, the total system of our body will not act accordingly. So these 3 things are very much important. Now on the test day, no heavy meals within 2 hours of the test. Within the 2 hours of the test, no heavy meal will be allowed, as because it may cause the stomach discomfort. It may produce some bloating, or there may be formation of the gas which may hinder the performance, or there may be some problem or the discomfort in the chest. Wear comfortable clothing and supportive athletic shoes so that the performance can be done easily. Bring list of current medication, means if there is any problem that if occurs during the test, so then and then the cardiologist can give the medication with the help of the doctor. Arrive 15 minutes early to complete the paperwork. There should be some formalities, official formalities before the test, so that should be completed before the test. So these are the patient preparation phase. Now, what are the contraindications and precautions that should be taken? Absolute contraindications means acute myocardial infarctions within 2 days, unstable angina, uncontrolled cardiac arrhythmias, symptoms severe aortic stenosis. All these should be reported immediately. Now, relative contraindications means left main coronary stenosis, moderate valvular heart disease, electrolyte abnormalities. These are all relative to these absolute contradictions. Now, some special considerations are also there, that physical disabilities limiting the mobility, then orthopedic limitations, then cognitive impairment affecting the cooperation. So, apart from all these contradictions, there may be some special contradictions as a consideration relative to the uh, physically challenged part. Now, the most important part of the TMT, that how the results are interpreted. In the monitoring sections, we have seen that in three main part we have to monitor. Number one is the electrocardiogram, means ECG we have to monitor. Then hemodynamic changes we have to monitor, and if there is any normal considerations like fatigue, dizziness, and all. Now, how they are interpreted? Like number one, exercise duration and workload achieved, means whether the person is able to complete the whole task given to the by the cardiologist. Next, heart rate response and recovery, means what was the pre-exercise heart rate, that means the heart rate before exercise, how the performance of the heart was during the exercise, whether the heart rate increased according to the increment of the workload, then within how much time the person can recover our heart rate, because it is very much essential. More quick the recovery, more strong the heart is. Next, blood pressure responses to exercise. Just we have discussed about that, that whether the systolic blood pressure is dropping down, whether there is any problem in the blood pressure, if there is fluctuating blood pressure. ECG changes, that is mainly the ST segment and the T wave, then particularly ST segment deviation, then development of symptoms during exertion. So all these should be checked carefully, and all these are interpreted. Results are typically categorized as positive. If the results are positive, means abnormal, negative means normal, and inconclusive means there may be some problem due to which the results cannot be interpreted. A cardiologist analyzes the data within 24 to 40 hours, 48 hours, and provides a comprehensive report with recommendations. So this is the chapter of how the results are interpreted. Now, what are the risks and limitations of the TMT? Number one, accuracy limitations. False positive occur in 15 to 20% of cases, especially in women, because of the menstruation problem. False negatives are seen in 10 to 15% of patients with single vessel disease, which is not identified previously. Baseline ECG abnormalities can complicate the interpretation. Safety consideration. Serious complications are rare, 1 per 10,000 cases, including heart attack, death, etc. Minor complications like dizziness, arrhythmia, excessive BP response. So these are the safety considerations which we have to consider. Effort dependency. Submaximal test that doesn't reach target heart rate due to fatigue, mobility issues, or medication effects, or the patient may not want to give the total uh, means effort to complete the test. So these are the risks and the limitations of the TMT. So regarding the real world application of TMT, It helps in the post cardiac event rehabilitation. That means when a person undergone the exercise test, and if he or she had any cardiac problem, then after that event, how the rehabilitation can be done, what will be the ideal rehabilitation procedure for that particular person. This all can be predicted or can be suggested depending on the um, interpretation done on the results of the TMT. Next, occupational fitness assessment. In case of the firefighters, then police, the military, where the physical strength is required, this TMT test is very important for the selection of the proper candidates. Athletic screening. So master athletes more than 35 years with multiple risk factors, that should be screened before sending them for the vital competitive sports. Next, medication effectiveness. Serial TMTs help assess in anti-anginal medications or interventions, have improved exercise tolerance and reduced ischemia, guiding therapy adjustment. So these are the real world application. So these all should be kept in mind. Number one is post cardiac event rehabilitation, occupational fitness assessment, athletic screening, and medication effectiveness. Now, TMT versus other cardiac test. You people can see that here is TMT, and here is a nuclear stress test, which is also helps to determine the stress on the cardiovascular system. Likewise, stress echo. So here is a comparison which is good, which is bad. So you can go through. What is the summary and what you should remember? So number one, established a diagnostic tool. TMT remains a cornerstone of cardiovascular assessment despite newer technologies. So it is the old technology which is so far so long much more reliable and pocket friendly. Comprehensive assessment. This can be done by the TMT like cardiovascular fitness, functional capacity, exercise response, respiratory system response also. Patient-centered approach. Results guide personalized treatment plan, exercise participations and all. So thank you for your patient listening. Please do like, share and subscribe my channel. The name of the channel is eduhub.2m, which almost daily shares educational videos related to various subjects like medical, paramedical, nursing, then nutrition, then statistics and all. And you can feel free to ask any questions in the comment section, and I will happy to answer them all. If you need more informations about TMT, you can write to me and I will accordingly try to give the satisfactory informations. Thank you very much for being with me for so long. Hope this video is helpful for you all. And this is not the end. I will upload more of this cardiac technology related videos so that this chain should continue and the person related to this subject can get benefit from my channel. Please do share with your friends who also want this type of video to perform good in the examinations. Thank you so much. Be with me.